There's a lot that's going really well in the space. So I serve also on the congressionally directed medical research program as a patient reviewer for IBD, and I'm seeing a lot of amazing research that's being done. There are new drugs, there are new approaches to team-based care for GI, and I think that folks in the space coming around, and it's a growing, ecosystem that is evolving and doing better. I think that the problem that I have is not maybe necessarily a GI problem. I think it's just a healthcare issue, and I think the healthcare issue and something that I'm very passionate about is that healthcare is the only market where the end user doesn't really have a voice. Here's what I mean by that. So if you are a consumer of shoes, right, you will go and you'll go to your store and you'll purchase the pair of Nikes that you like. And Nike will take that and say, people are voting with their dollars. People like the gray shoes with the red stripe, and I'm going to make more of those because that's what people want and that's what people need. And in healthcare, there is no real direct way for someone like myself to vote, right, with my dollars. And so what ends up happening is that the needs of the patient are either filtered or not heard. And by that, I mean like the need of the patient is either filtered through the GI. The GI then gets, to the pharma company, to the health system, to the insurer. And it's like a game of telephone. It gets distorted. And I think the challenge that I have with GI and with healthcare in general is that what then happens is that the companies that are building in the space, right, the ones that are innovative and putting tons and tons of dollars behind it are the health systems, are the insurers, are the employers making those decisions with assumptions around where those patients are and what they actually need. And I think at the end of the day, we talk a lot about patient centricity, but unless you are a patient, there's always that little gap. I think that unless you lived with it every day, I don't think you can make assumptions about what it's like to live with it. And that's where I think you see a lot of the statistics that are kind of shocking to people about what it's like to suffer in that silence, right? These conditions are taboo. Like, we don't like to talk about poop. I certainly didn't. And so patients like myself just sit around there and we are unproductive at work. We are uncomfortable. There's some really interesting statistics out there that just illustrate this and shock a lot of people, like that patients like myself are willing to give up 15 years of our remaining life expectancy for an immediate cure today that doesn't exist. That's like 20% of someone's lifespan, that acute need and what it's like to live with the condition, but also work in the environment of siloed places, of being essentially the CEO of your own condition because no one's doing it for you. And I've had to do that, right? And you see patients are incredibly resourceful. You have people building their own Excel models, people writing things in notebooks, gathering reams and reams of information so that they can problem solve for themselves in an environment that is not surrounding that patient. And that's like a big piece to me, kind of in conclusion, is that being patient centered is different than being patient driven. And patients being founders, I think, is something that I'm really excited about that we're seeing in this space as well as other spaces. Those are a couple of the observations that I found and that I've lived with. And I figured, why not give it a shot? I've lived with it, 10 years of market research. There's an opportunity to change the industry in the way that we think about it by putting the patient as the driver, not as the passenger.